We just finished up the legislative session for the 89th General Assembly. It was 100 days, which actually was the longest legislative session since the Great Depression, so it was a little longer than normal. The session started a little bit slow and focused the first several weeks on some of the social issues of abortion, guns, and voter identification and some of those issues. But then we moved into some of the more monetary, budgetary type issues. One of the first major issues that we dealt with was the approval of Amendment 82 bonds for the Big River Steel project up in northeast Arkansas near Osceola. It's the first super project that we've issued or approved those bonds for. They are to have at least 500 new jobs at an average pay of $70,000 to $75,000, and they have a $1.1 billion investment. The state did contribute about $125 million toward that. $70 million was a guarantee of was a grant or a contribution under Amendment 82, and then $50 million is going to be a loan that is to be repaid. One reason I was particularly interested in that is we are also talking to another company about a South Arkansas industry that could also qualify. So I might be going back to my colleagues at some point to ask them for assistance on that. Another really big issue, and probably the major issue of the session, was the Medicaid expansion that we're now referring to as the private option. It was very controversial because a lot of people campaigned against Obamacare or the Affordable Care Act, but the thing we really had to look at was, we don't decide whether that act is going to stay in. That's a federal issue. We've just got to do what is best for the state of Arkansas. The bill that was ultimately drafted and passed had many safeguards in it as far as if the federal government changes anything, then this program will go away. But in the meantime, it will provide insurance for individuals that make up to $15,000 a year or families of 4 that make up to $30,000 a year, and really will help reduce the uncompensated care at our hospitals. And I've got 4 hospitals in my district, and so I was supportive of that, and it actually is an economic generator for the state over a longer period of time. Once we got that issue done, then we dealt with tax cuts. We approved tax cuts that total about $10 million for the 2014 fiscal year, $85 million for the 15 fiscal year, and over $120 million for the 2016 fiscal year. Once that was all done, we put the budget together. It totals about $4.9 billion. It's about a $197 million increase over the previous year. Most of that either goes to education or to Medicaid, and a $10 million increase also to higher education. But with that said, we voted on those budgets Monday and Tuesday of this week, and the only other budgetary type matter was some surplus funds. SAU will be getting an additional $1,150,000 of some of the surplus funds in addition to their regular funding, and I was glad to assist with that. All in all, I think a good session, even though a little bit long, and was glad to represent the people of Columbia County in the State Senate.
Is there anything in particular that you wish that the legislature had taken up that it didn't, or didn't have time to finish?
Well, I think we hit most of the key issues. One of the things that really, I guess I was least certain about as we left the session was some of all the laws that we passed having to do with elections and integrity of elections. And actually the governor vetoed 3 of those bills. And we have yet to decide whether we will go back to override some of those vetoes. The most important thing with elections is that they're fair, that there's honesty and integrity in that process, and that they are not partisan on either side. And so we had a number of bills. I wasn't quite sure how they all fit together, and I think the governor had some of those same concerns. But with respect to budget, education, economic development efforts, and the health care with this private option with all the safeguards, I think it was a good session.